Begin by placing MR EMG sensors on your subject's upper trapezius muscles and lumbar paraspinal muscles. When applying sensors to the lumbar paraspinals, have your subject stand and flex forward slightly, as demonstrated here. Doing this will reduce signal artifacts caused by skin movement during testing. Follow our recommended muscle placement sites. Show your subject how to perform a maximal voluntary contraction of the upper trapezius by way of shoulder shrug using MR EMG biofeedback. Now record your subject performing 3 maximal voluntary contractions of the upper trapezius muscles simultaneously. Ensure you take a picture of each activity so you have an image to match your data. Now show your subject how to perform a maximal voluntary contraction of the lumbar paraspinals using MR EMG biofeedback. Record this using the Superman or prone cobra exercise. Ideally, record your subject performing 3 maximal voluntary contractions of the lumbar paraspinals. If your subject is suffering lumbar pain, please modify this testing protocol to suit the individual. You do not want the movement to cause additional pain. Now ask your subject to stand on the floor and perform the lumbar flexion relaxation phenomenon test of lumbar spinal activity. As described by Nogaro et al. 2012, the flexion relaxation phenomenon is the silencing or relaxing of the lumbar paraspinal muscles when a person flexes their trunk, such as bending forward to touch their toes. In subjects with chronic low back pain, this relaxation of the lumbar back muscles is typically absent. Now record the upper trapezius and lumbar paraspinal muscle activity of your subject's natural walking gait. Compare this muscle activity during walking gait to their maximal voluntary contractions to assess if any hyperactivity is present in the upper trapezius or lumbar muscles. If there is hyperactivity present, provide advice on postural recommendations, such as gently pulling the shoulders down when walking or standing upright, asking your subject to walk again and measure if there is an improvement. Show your subject the resulting EMG data recording of recommended movement changes. Now assess the upper trapezius and lumbar paraspinal muscle activity performing daily activities most suited to your subject. For example, we will evaluate this subject's muscle activity vacuuming. We will now test our subject's muscle engagement using the following exercises, starting with pelvic rocking, now bird dogs, and lastly side bridges. We will complete our data gathering for this subject by performing 2 gym exercises, starting with using a cross trainer and finishing with dumbbell deadlifts. The exercises you test are entirely up to you, the clinician, and what you would deem most appropriate for each subject based on their symptoms. To conclude the assessment, we recommend you sit down with your subject and analyse their data, identifying any muscle hyperactivity or inactivity during movements you feel is related to their symptoms. We hope you enjoy using MR EMG.